Many people ask me about what to do when they have a shoulder condition. There are several conditions that, sort of fall into this category of an irritation to the shoulder joint that needs some specific exercise rehabilitation. So I'm going to talk today about shoulder impingement, when you feel a pain in an arc of motion when you lift your arm up. Like, let's say you take your arm, you start to move it out to the side, and you feel ow, 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 and then it gets better as you go the rest of the way. That's called a painful arc. This is helpful with that. That's a pinch, an impingement in the subacromial joint. And the second one is a rotator cuff tear, which is kind of diagnosed by usually just a problem when the doctor tells you to put your thumb down and presses on, and that's called a drop arm test. When you can't hold your arm out with your thumb down, doctor pushes on it, and it goes straight down. So those are the two kind of conditions where you need to rehabilitate, strengthen the shoulder, and you can do so with a few simple things I want to show you today. So let's begin with isometric exercise. Isometric means that you're going to exercise without moving the joint. You're going to contract muscles, strengthen them, and this is particularly important when we're talking about the shoulders because we want to stabilize the shoulders. The reason the shoulder starts pinching something or starts to tear is the muscles are not able to handle the tension needed to hold the shoulder stable. And the interesting thing with the shoulder is, with so many options and degrees of freedom of movement comes instability. So we need our muscles and our tendons and our ligaments and our soft tissue capsule around the joint to be strong and stable. So isometric is going to be the key to stabilizing that shoulder joint in the early days. So that's an exercise with no movement. I want to show you a few different directions to do shoulder isometrics. We're going to do a 5-second hold, 10 repetitions of each one. Let's begin with shoulder flexion. And the way that's going to look is you're going to use your other hand. I'm doing all of these with just my body, but you can find all kinds of videos online to do these next to a wall and so forth. But the first one is to resist the forward motion of the shoulder. So I'm going to use my hand to stop the forward motion, and I'm going to push forward 1, 2, 3, 4, 5, and rest. Again, I'm trying to push forward, but this hand is limiting the motion, pushing 1, 2, 3, 4, 5, rest, and 1, 2, 3, 4, 5, rest, and 1, 2, 3, 4, 5, rest. You'll keep going like that. Notice I have my elbow next to my trunk. Let's do it from a front view. 1, 2, 3, 4, 5, rest, and 1, 2, 3, 4, 5, rest. That's shoulder flexion. Then is abduction, or taking the arm out to the side. I'm going to resist this outward motion. This is one that's nicely done next to a wall, but you can do it all by yourself by holding here on the outside of your elbow and resisting this outward motion like this. Resist. 1, 2, 3, 4, 5, rest, and 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 repeat. Shoulder adduction, or adduction, is done by putting something right here in between. Let's see what I have. To pull your shoulder in towards your trunk. So what I want to do is I'm going to use this pad to resist me pulling my elbow in towards my body. Pulling my elbow in towards my body. 1, 2, 3, 4, 5, release, and press. 1, 2, 3, 4, 5, release, press. 1, 2, 3, 4, 5, release, and 1, 2, 3, 4, 5, release. Again, pinching something that you put between your elbow and your trunk. Make sure you're keeping your core stable and engaged, that your shoulders are staying even and that they're staying relaxed. Don't let your shoulders creep up towards your ears as you do these exercises. So far we've done flexion, pushing forward. We've done extension, pulling back. We've done abduction, taking it out to the side, and we've done adduction, pulling it in. Now we have the rotators. Those are the key important ones in shoulder rehabilitation, particularly because they attach to that rotator cuff. So we're going to do isometric external rotation. It looks like this. External rotation of the shoulder is this motion like this. But we're going to do an isometric because right now, if it's hurting in the shoulder joint, you don't want to do all this movement. You want to strengthen and stabilize by resisting that motion. Here's what it looks like. You can have your hand over or under. It doesn't matter to me, but you're resisting this motion. So I'm going to put my hand over and resist that motion with a 1, 2, 3, 4, 5 release, and resist 1, 2, 3, 4, 5 release, and resist 1, 2, 3, 4, 5 release. Last one, and 1, 2, 3, 4, 5 release. So I'm showing you 3 or 4 reps, but I want you to do up to 10. You're going to work and exercise in your pain-free range of motion. So I'm not going to make you watch me count all of these, but these are the key isometric exercises. That was external rotation. Next one is internal rotation. It's the opposite motion. Internal rotation looks like this, bringing my arm across the front of my body, but you're going to resist that motion with your other hand. And so press 1, 2, 3, 4, 5, release. Press 2, 2, 3, 4, 5, release. Notice this shoulder is relaxed. It's not up here. Press 1, 2, 3, 4, 5, release. Last one, press 1, 2, 3, 4, 5, release. So those are 4 motions that are going to be really important. Actually, that's 6. It's flexion, extension, adduction, external and internal rotation for shoulder isometrics, okay? Don't be swinging your arm around like this. If it's hurting you, I'm showing you that for an example, but I want you to keep that shoulder nice and secure and stable. Remember, ice for 20 minutes. You can use ice pack on the shoulder joint for 20 minutes several times per day. It's particularly helpful after you do these exercises. And I'm going to show you the one more thing that's going to be helpful in the early stages of your shoulder rehab, and that's called pendulum exercises. So I took a weight here. This is a 5-pound weight, probably heavier than you want to use in the beginning. I recommend a 1 or 2 pound weight for my patients in the beginning, but you're going to really try to get some pull or some release in the shoulder, especially in terms of impingement when it's pinching in there. When you feel the pinch in your shoulder joint, you want to use these pendulum exercises with a small weight or a can of green beans or something in your hand, and you're going to swing gently. Just let that shoulder have some traction on it. It's especially helpful because traction does relax the muscles, relaxes the tension across the shoulder joint, releases the compression of the bones in the joint, and it kind of helps to lubricate inside the joint space and relax that shoulder. It's a comfortable thing to do. It's a nice fascial stretch. You can slow it down and just gently swing. I have people swing the pendulum forward and backward, out and in. So that's going, out and in. And then doing circles is a good, or even doing an alphabet shape. So you can make, with your pendulum swinging down, you've got this in your hand, you can make an A and a B and a C and taking it through the alphabet. It's a nice way to end the exercises with a little bit of joint decompression in the pendulum. And none of that should be real painful for you, and then end with 20 minutes of ice. I hope that's helpful to show you that you at home have the power to help start rehabilitating your painful shoulder. And there's much more to follow after that, but this is really the first step before you want to start using resisted motion with either exercise bands or weights or other things like that. So hope that's helpful.